Okay, let's talk about one of the most common and frankly most annoying denials you're going to see, the CO-197 no authorization denial. In this explainer, we're going to break it all down and give you a clear step-by-step playbook to get these claims paid. I mean, we've all been there, right? You see that denial code and your heart sinks a little. You just know it could be a super simple fix or a total wild goose chase. Well, the goal today is to give you a solid game plan so you never feel stuck on one of these again. All right, so here's how we're going to tackle this. First, we'll get a handle on what this denial actually is. Then we'll walk through your first steps, your initial investigation, and focus on the one piece of information that changes everything, the place of service. From there, we'll look at the two different paths for emergency and in-hospital claims, and then we'll wrap it all up with a nice, neat checklist for you. So, first things first, before we can solve the problem, we gotta understand the problem. Knowing the why behind this denial is absolutely key. At its heart, prior authorization is basically just getting a permission slip from the insurance company. For certain procedures, they want to say, yep, we agree this is medically necessary before it actually happens. When they give that approval, they issue an authorization number, and that number is your golden ticket for getting the claim paid. Now, the code 197 code is actually pretty helpful because it's so specific. It's not some vague, mysterious denial. It's telling you exactly what's wrong. Someone either forgot to get the pre-auth or they got it and it just didn't make it onto the claim form. And check this out. This little cheat sheet basically gives us our game plan. See those questions about finding the hospital's claim for the same date or asking to use their auth number? That's a perfect little preview of the detective work we're about to do. So let's get into that investigation. Now, before you even think about picking up the phone to call an insurance rep, your very first move should always be to look in your own backyard. Seriously, always start with the easiest possible solution. It is so common for the authorization number to actually be in your system, but for whatever reason, it just didn't get attached to the claim. One quick check could save you a ton of work and turn this into a really simple phone call. Okay. This is where most of us get stuck, right? The auth number isn't in your software, and it feels like you've hit a dead end. But you haven't. This is just where the real investigation starts. And believe it or not, it all comes down to one little detail on the claim form. And that key detail, it's the place of service or POS code. This little two-digit number is everything. When it comes to no auth denials, this code is the fork in the road that's going to tell you exactly which way to go. We're specifically looking for one of two codes here. Is it POS 23, which means the service happened in the emergency room, or is it POS 21 for a patient who was formally admitted as an inpatient? Because your entire strategy, everything you do next, depends completely on which of these two codes you see. Let's start with the more straightforward of the two paths. Emergency services. If you see that place of service code 23 on your claim, you've got a really powerful argument on your side. Your whole argument here is built on pure common sense. You can't get prior authorization for something that's an unforeseen emergency, right? So you get on the phone, you state clearly this is a POS 23 claim and it needs to be reprocessed. Now, if the rep still gives you a hard time, your ace in the hole is to ask to be transferred straight to the retro authorization department. All right, now for the other path. This one's a little more complex, but it's totally solvable. We're talking about in-hospital patient claims with a POS 21. This is where you get to be a little bit of a detective. The key here is to remember you weren't the only provider involved. The hospital sent a claim, the surgeon sent a claim, and you can bet one of them got the authorization. So you just ask the insurance rep to look up their paid claim for that same date of service, find that authorization number, and apply it to your claim. It's an awesome trick. You're basically using their paperwork to get your bill paid. Okay, I know that was a lot to take in, but what's great is that this whole thing boils down to a really simple, repeatable process. So let's put it all together in a quick checklist you can use every single time you see a CO-197 denial. This is your game plan every time. It's so simple. Step 1, check your own system. Nothing there? Step 2, check the place of service. If it's POS 23, you argue emergency. If it's POS 21, you borrow the auth from the surgeon or hospital. And if all else fails, your final fallback is to ask for a retro authorization. This little workflow will get the job done for you almost every time. And you know, that really is the ultimate goal here. This isn't just about fixing one single denied claim. This is about creating a process, a system you can teach. When you train your whole team on this workflow, you stop just reacting to denials and you start proactively resolving them faster. And that, right there, is how you improve your entire revenue cycle.